Alrighty, good afternoon, everyone. I am Councilmember Johnson. With me today is our Director of Housing, Sally Stang. Commissioner Cruz was supposed to join us, but she is in a meeting right now, and she will be across the street handling some very important business. So we'll get started today with just myself and Ms. Stang. So I want to thank everybody for joining us today, and we're going to talk about investing into our most economically disadvantaged areas. And just want to make sure if you have any questions related to services or those specific areas, you can write them below in the comments, and we'll make sure we get those, and we'll address those when we get to the end of some of the information we want to share out today. Earlier this month, we received a $2.5 million in new HUD funding after the passage of the CARES Act. And I want to turn it over now to Sally to talk about that. So, Sally.
Hi, well, good afternoon. Thank you for having me. Yes, we were really excited, and we received $1.7 million in CARES Act's Community Development Block Grant funds. Our annual allocation is about $2.8 million normally. So it is a pretty significant investment of an additional $1.7 million. And CDBG is really flexible funding that came about from HUD back in 1974 when they collapsed 8 different grant programs into one flexible use grant program, but whose goal really is about building up communities and helping low and moderate income families in our community. In addition, we received $850,000 in emergency solutions grants funding, and we lovingly call ESG. And ESG is specifically used to address issues related to homelessness. And our normal annual allocation from HUD is only $238,000 a year. So when we received $850,000 under the CARES Act, it really hit home just how much the federal government was expecting the coronavirus, COVID-19, to hit and spread among our homeless population. So to date, we've actually already allocated $60,000 to Humankind Shelter to extend that shelter service to a 24/7 operation through the end of May. We are extending their contract now through June, which will be another $60,000. And we've made $300,000 available through the United Way to provide motel rooms for homeless individuals that either are awaiting test results because they're symptomatic, or for those who have tested positive to try and slow down the spread of the virus. Now, the requirements from HUD are the funds can be used to prevent, prepare for, or respond to COVID-19, but yet still have to be used in a way that's applicable under the grant requirements. So for ESG, that's making sure that we're addressing issues related to homelessness. And for CDBG, there are national objectives that have to be met as far as serving low to moderate income households or a low to moderate income areas of the community by addressing blight, whether spot blight or area blight, or dealing with an emergency. So we have a lot of work left to do. Now, normally when we get these funds, we spend a lot of time in the public participation process. When we complete our consolidated plan, our 5-year action plan, we spend about a year working in neighborhoods, working with agencies, trying to determine the needs, studying data. And then we spend about 6 months each year creating an annual action plan where we set up exactly what projects we want to use the funding for. Now, with this CARES fund, now HUD's granted us some waivers of some of those requirements, but it's kind of a double-edged sword. We have funding available to try and address issues related to COVID-19, but it's going to be most useful if we can enact it quickly. And so it's really restricting our ability to do that full-fledged public participation process. So that's a good thing and a bad thing, right? It lets us be a little bit nimble, but yet we want to make sure that we're hearing from everyone, which is our challenge right now, is we're evaluating what are the needs in the community and how the use of these funds can be best used. So we do have we want to protect our residents. We do have to projects that are outside of our normal consolidated plan for public comment, and we're seeking that public comment for sure. We have staff reaching out every day, talking with different low and moderate income families, elderly, disabled in our community, trying to find out where the needs are so that we can devise programs that'll best fit for our community.
Awesome. So one quick question, just following up on what you just said, could you tell the community how they can provide that feedback?
Sure. Right now we're posting, we have posted the motel vouchers when we are contemplating a project. We're posting that on our website, wichita.gov, to find information on the Housing and Community Services page. And then we're accepting by phone or by email. Email is usually best at wha@wichita.gov. Can submit comments about proposed projects or give us ideas for other projects.
Awesome. So aside from how the community may provide some feedback, I've been hearing from pastors in the community, small businesses, and especially members of historically Black neighborhoods about needs that they may have as far as investment, testing, and things like that. Do you have any ideas just kind of off top of how we can utilize those funds as we're receiving public comment?
Sure. I mean, the funds are extremely flexible. We're working very closely with the Sedgwick County Health Department. Expansion of testing is a huge need. We're having discussions also with Hunter Health. We're trying to get testing inside homeless shelters and other congregate housing areas and into neighborhoods. Right now, testing has been the biggest challenge for our community. And when you hear, testing levels in other communities are significantly higher than what's happening here, we're celebrating when we can do 100 tests in a day, where other communities are looking at thousands of tests in a day. Until we get a broader range of tests and the testing supplies, we really need to be focusing that into the low-income neighborhoods and communities. But we can also use the funding that we've received to try and fill in some of those gaps. So we do have, under a community service block grant, we are rolling out a program to help provide interim rent assistance and utility assistance for people who've either lost their jobs, so we're developing programs as quickly as we can. And I know everybody's really focused right now on how we're going to reopen, the community. And as a department, we're also challenged not just with reopening the community to address what we normally do every day, but also trying to roll out new programs that can make a big impact if we can get them rolled out quickly.
Awesome. And then specifically, I know I said it and you kind of touched on it. So if we wanted to use, this was a question I had received, these funds specifically to purchase tests or to support a neighborhood clinic to do testing, could that be an option?
It absolutely could be an option, but the biggest challenge is going to be getting our hands on the tests.
Right.
And to be able to purchase them. Absolutely.
Awesome. Before we jump into any questions, I want to read for anyone who may not have maybe heard the mayor's briefing earlier, just some stats that were provided by the county, again, since Commissioner Cruz couldn't join us. We heard this morning, John Hopkins reports that there are 1,040,488 cases of COVID-19 in the United States, 3,839 cases here in Kansas, and 366 cases here in Sedgwick County. So far, 184 people have recovered from COVID-19 in Sedgwick County, and 9 people have unfortunately passed away from it. The Sedgwick County Health Department has expanded its sampling and testing ability, which allows many more people to be tested for the disease. This week, we've averaged about 90 people per day. We have the ability to take samples from at least 100 people per day. Residents with at least 2 symptoms of COVID-19 or a respiratory illness may be tested by appointment by calling the United Way of the Plains at 211. Tests performed by the health department are done at no cost to the residents. By testing more residents, we can get a better understanding of the spread of disease here in Sedgwick County and continue to work toward controlling it in our community. There is currently no vaccine or treatment for COVID-19, so the best prevention measures include continually washing your hands with soap and water. Sanitizer is okay, but soap and water is the best for at least 20 seconds. I always say 30 just to be sure. Staying home unless you absolutely need to leave. Covering your coughs and sneezes. I say keep your germs to yourself by coughing or sneezing into your elbows, and maintaining social distancing, which is about 6 feet away from one another. And although many of you may know the news, the governor will be expected to share her plan for reopening tonight at 6:30. So definitely pay attention to that. We are continually hearing from residents and businesses to proceed with thinking about opening with caution, so making those plans and keeping all of those measures in place. So those are the updates from earlier today. Do we have any questions?
We do. During this time of the pandemic, how can people go about seeking public housing?
So unfortunately, our public housing program, the waiting list has been closed because we're in the middle of a redevelopment plan to rehabilitate the buildings and transfer it to another subsidy type platform. But on the other side, most of the inquiries we get are about the Section 8 Housing Choice Voucher. And our original goal was to open up the waiting list April 1st, but then the pandemic hit. And we felt it would be inequitable to open up the waiting list that can only be done online at a time when the libraries and the community resource centers were not available to help those that didn't have the means to be able to do that application on their own. So we have postponed the opening of the waiting list. It will happen probably 30 to 60 days after the stay-at-home order is lifted. We will be doing a press release and a lot of advertising of the opening of the waiting list. But once someone gets on the waiting list, unfortunately, it can take years sometimes for people to reach the top of the list.
All right. Well, we will stay on and allow for a couple more questions if they come.
Sure.
If you could, I know you've broken this down a couple times, Sally, but what was the award regard to our homeless community and the motel that could be used for isolation if necessary?
Sure. So we just are executing, we're actually amending that contract. It's coming back to the council because we had some legalese that needed to be updated. But we're providing just over $300,000 through the United Way to be able to provide motel vouchers for those who need to quarantine. So we have, Sedgwick County Health Department is now doing evaluations of hotel rooms to determine whether the room itself meets the ventilation systems and community access, avoiding people possibly infecting others that are staying there. So once we have a listing, and the publicity has been fabulous because we've had a lot of hotels and motels reach out to us and say, hey, we want to help. How do we get evaluated and see if we can have some people placed? So that will all be handled through the United Way, who's also coordinating with the Salvation Army to provide meals to anybody who is in isolation, because we don't want to just take someone who is obviously ill and put them in a hotel room and not provide them service. So they're coordinating other services and meals, laundry services to make sure that they are safe during this time and that others in the area are safe.
Awesome. We have another question.
We do. Tiffany just tuned in and she's wondering when we should know more about the stay-at-home order opening up.
So I know that the governor will make her announcement tonight at 6:30, and that will be for the governor's order, whatever that announcement might be. And I know the county commission is also having discussions about what a safe opening looks like. And I would expect to probably hear that plan next week because the current order from the governor expires on Monday. So I'm sure we'll be hearing that very soon from both entities.
Perfect. And the next question is, if residents think they have symptoms of COVID or need resources, what's the number that they can call?
So residents with at least 2 symptoms of COVID-19 or a respiratory illness can be tested by appointment by calling the United Way of the Plains at 211.
Perfect. And I think that's all we have.
Awesome. So we don't have a whole lot of questions today. Sally, did you have any other information you wanted to share?
We are expecting additional funding besides what we've received from HUD so far. We will have additional funding to help voucher holders, to help public housing residents. And then we're expecting more funding from the Community Service Block Grant Program, which is through Health and Human Services. And we will be going out to the public again, looking for and discussing programs to use those funds. So stay tuned, more to come.
And one last thing, I know as a city, we're looking at our plans as far as what reopening may look like. And the housing department, you all run a summer job program. Have you had any discussions about that and what that looks like for our young people this summer?
Absolutely. I have been discussing at length. We are evaluating multiple different means. We want to provide at least the education piece. Even if we can't place the kids in jobs this summer, because it really depends on what happens once the community opens up again, whether we see increases in the spread of the virus. So we are kind of trying to stage multiple different plans, but at least we want to have the education piece. So we're looking at employing some of the virtual training pieces like they are through some of the schools. If we can do small group trainings, we're collaborating with USD 259. We really hope we might be able to still place at least for several weeks, but that really depends on what happens with the spread of the virus in the community. So it's kind of like this hurry up and wait. But we are looking to open up that application through the city's website for kids who are interested in that training and possible job placement this summer, but we are going to have to play it by ear.
Awesome. And one last thing that came to mind, I was asked this question, and just to give a little context, we've been working on trying to reduce violence in the community for a number of years now. Lots of us, myself involved. And one of the concerns that I had going into this that I've been also hearing about is domestic violence. Are there opportunities for some of the women's shelters or other organizations to maybe apply for more funding during this time, because folks are supposed to stay at home and that may not always be a healthy opportunity? So is that available?
It definitely is on our list. It was one of the first things that we already fund domestic violence shelters now and counseling services now, and it was one of the things we talked about and said we're seeing a trend in the crime statistics showing there's definitely an uptick in that area, and that might be one of the first projects that we move forward, is just to be able to expand their capacity during this time.
Perfect. Do we have any online?
No.
Awesome. Well, Sally, thank you for joining us today. And again, we'll probably try to schedule another one. I know Commissioner Cruz was really excited about joining in on this call, so we'll probably try to do this again when we have more information to update. But I want to thank everybody for joining in and asking questions. And again, Sally, thank you for joining as well.
Thank you so much for having me.
All right, thank you. Everyone stay safe, stay healthy, make sure your hands are washed with soap and water and social distance, and wear those masks in public. Thank you.